Hello, I'm here doing my demonstration speech with my mom, and I am currently work as a nursing assistant, and NAC for short, and when I was learning to take the class, I was taught all kinds of different skills, and the most important skills that I thought were important was taking a set of vital signs. Out of the 4 set of vital signs, there are temperature, blood pressure, breathing rate or respiration, and the pulse or heart rate, pulse. And the most important vital sign that I believe is important is taking a blood pressure. So I'm going to show you some simple steps on how to get a proper blood pressure and make sure you do it correctly, because it can be done not quite the right way sometimes. So what you need to take a blood pressure, obviously, is a patient. That's going to be my mom. And you need the blood pressure cuff, which is right here, and the machine or automatic blood pressure is what these are known as. So first step, you want to make sure to get the right size cuff when you're taking a blood pressure, because for accuracy, if you have one that's too small or too large, it's going to throw off your numbers and not be completely accurate. So that's the first step. Then the next step is you want to put the cuff on the arm. So we're going to do that here. And you can see, kind of sort of there's a blue line, and then there's a cord that kind of comes out of that. So that's what you want to make sure to put on the vein. So and you want to have it on the left arm, because that's where the side of the heart is. It gets the most accurate reading. Blood pressure is all about accuracy. Pardon the noise. There we go. And I'm going to flip around there. And you get it in there. And you want it snug up on the artery. And again, you want the blue line to be kind of where the line of the vein is there. And then we're going to snug it in. And then you just come down here. And we're just going to push the start button down here. And we're going to let it go. There we go. Maybe. There it goes. And as it's pumping, you'll hear a little noise. That's getting the pressure, and it's pumping up and putting pressure on her forearm there. And as you can see, the numbers kind of pumping up there. Might be backwards. It takes a minute or two to get. And now it's starting to release the pressure. Once that noise is done, the pressure is now starting to come away from her forearm. And we're just... Now you can hear. So now we're going to look at the results here. Pardon me. Her number is 105/73. So now that we have that number, we're going to record that. And the numbers that we got, the 105 what is known as the systolic number. And that is the number where the pressure of the heart is contracting. That's what that number indicates. Then the diastolic, which was, again, the 79, that is the number that is when the heart is filling with blood. So that's the pressures of the 2 numbers and what they mean. So now that we've got our numbers, we're going to go ahead and take off her cuff, because we're all done. And those numbers are measured in millimeters of mercury, which is just essentially a measure of pressure. So that's how you take a basic automatic blood pressure cuff. Now, the average blood pressure is 120/80. That's the average. Hers is in a good range. There's always a range of numbers for both the systolic and diastolic. So that's what makes it so difficult, because people think it should be similar for everybody, but that's not the case. So that's my main take-home message here, is that not everybody's blood pressure is going to be the same. So you just need to be aware of that as you're taking it, and know that when you're taking the blood pressure, it's not always going to be the same. But of course, when you're taking the automatic, it's going to be pretty easy. However, in today's medical field, some areas still like to do the manual. So I'm going to kind of take a couple steps and show that for a minute. The couple extra things you need when you're taking a manual, along with the cuff, and the cuff has a pump and a valve. And of course a stethoscope, which has the earpiece and the chest piece. You put the cuff on just the same as you would with automatic. Make sure it's right where the vein meets and the cords come down. And then you're going to put the earpieces in your ears of the stethoscope. And then you're going to put the chest piece, move that out of the way for a moment. You're going to put the chest piece, as when the cuff was on my mom's arm, you remember it went right to here. You're going to put the chest piece kind of right underneath that so it can hit the vein. And you're going to pump. You're going to make sure the valve is turned all the way to the right. That's going to indicate no air is going to come out. So once you do that, you're going to pump, pump, pump. And you're going to want to pump up to about a range of 130 to 140. And then as you get there, then you slowly start to release the valve and let the air go. Once you do that, you're going to hear some sounds that sound just like a heartbeat. And you're going to monitor that number when you first start to hear the sounds. And as it goes down the line of the numbers, you're going to stop hearing the sound in between the range of 70 to 80 range. That's where you're going to stop to hear the sound. So when that happens, that's your going to be your diastolic number. And again, up at the top, when you begin to hear the noise, that's going to be your systolic number. And you mark those down, and that's the blood pressure doing manual. I have to do that at my work a lot because we're manual. But as like at a hospital or doctor's office, they still tend to do the automatic. But some are manual. So that's why I kind of showed you both. So, like I said, my take-home message is just that everyone's different, so it's important to know how to take a basic blood pressure, and that's what I've shown you here. So I hope these steps are helpful, and you remember them when you need to take the blood pressure next time. So again, I'd like to thank my audience and patient, and I'll look forward to seeing your guys' videos. Thanks!